Have you heard of integrated health? Well, what about remote monitoring? Well, you're not alone. But today on Being Well, we have Horizon Health Emergency Service Director Samantha McCarty to break down how integrated health and remote monitoring are making waves when it comes to patient care. Stay with us.
They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
Thank you for joining us for this episode of Being Well. I'm your host, Lacey Spence, and today we are welcoming a new guest to the show coming to us from Horizon Health. We'd like to welcome Samantha McCarty. Hello, welcome to Being Well.
Thank you, Lacey. I'm glad to be here today.
Yes, it's wonderful to have you, and we love having new guests. If you could, please give us a little bit of background and what your title is at Horizon.
Sure. Again, Samantha McCarty. I'm the Director of Emergency Services at Horizon Health. And I have all things related to emergencies. So not only the emergency room, the emergency physicians and nurses, the ambulance staff, EMS as they're typically referred to, but then I also have what is called mobile integrated health and remote patient monitoring that goes along with that.
So it sounds like you're wearing a lot of hats.
Yes.
Do you have a favorite part of the gig?
I think my favorite part is innovation. So I love to hear what people struggle with their health care specifically, and then how can I solve that? I'm a fixer and a people pleaser by my Enneagram. So I think that just goes along with my personality. I want people to be engaged in their own health care. And when there's a disparity or a social situation or something that they struggle with, I want to be able to develop a service that helps that. And that's where mobile integrated health was born.
Yes, that definitely leads right into what we're talking about today, which is the mobile integrated healthcare and then also remote patient monitoring. So as we get started, let's go ahead and dive into what is mobile integrated healthcare.
So mobile integrated healthcare is something that is found in much larger urban cities. It's been piloted, it's had multiple names, they've called it home paramedicine, different things, but it's essentially ambulance staff or paramedics who are additionally trained to go into a home setting, not via a 911 call, but rather a scheduled appointment, and help people navigate their own health care, especially those with chronic medical conditions such as diabetes, congestive heart failure, COPD, and where we found ourselves, COVID-19.
So is that kind of the brainchild behind it? It started with the pandemic?
It did. We were looking at developing this service and really couldn't get it off the ground. And then all of a sudden, everyone was told, stay in your homes. They became fearful to go out, so missing doctor appointments, missing medication refills. And we started to see a sicker population based off of that. So getting those first responders who were used to going into the homes and knew how to protect themselves and protect their patients, we were able to spin this service not only to make them well, but then also to help carry them through with some of their other chronic conditions. So, for example, if a patient was diagnosed with COVID-19, we originally would set them up with home visits from our mobile integrated health team on days 1, 3, and 5 post-diagnosis. And then if they needed it ongoing support after that, we would offer that support for them.
Mm-hmm. So is this something that is popular in other areas, or is this new to being rural, or can you talk about that a little bit?
It is pretty new to being rural.
Okay.
It is offered in other areas. Most larger urban areas don't offer the services the same way we do.
Okay.
Their payment models for their hospitals are a little bit different from the federal government, the same way rural hospitals' payments are a little bit different from the federal government. So regardless, this is usually a free service. But there's different motives behind why it's the free service. Some of it's to keep people out of the hospital so that they can free up the beds for the sicker patients. Some of it is to prevent readmission penalties from the government. For us, it's a combination of all of those.
Yeah.
But what is close to my heart is it's doing what is best for the patient and meeting the patient where they need to be. Like I said, some people were very fearful of going out of their homes, but they trusted a paramedic to come into their home. So we use that to bridge the healthcare service to them. If they were afraid to come in and get a lab draw, we could provide that service for them. If they were missing some of their medication refills, we could facilitate getting that done for them. Really just meeting the patient where they needed to be.
Right, and definitely breaking down that barrier to care, because I know for a lot of folks, maybe utilizing a bit of a courier service or something, you know, someone who can run and go get errands for you. But like you said, if we were trying to really limit our exposure, having someone who can run to the pharmacy to grab my medicine, or being able to, you know, come help me check my blood pressure wasn't quite an option. So this program sounds like, you know, very innovative, very much filling that niche.
It really was. There was some hurdles, you know, to buy in, not only to patients but to physicians as well. But I think the COVID-19 diagnosis really facilitated the ease of getting that bridge to that health care, as you speak about. When I talked about going in on days 1, 3, and 5, we wanted to monitor someone for decreasing oxygenation status. If their oxygen was decreasing, we could facilitate getting them home oxygen. So it didn't necessarily mean that they needed to come to an emergency room where it was very expensive, or come into the hospital where they weren't sleeping in their own bed and they weren't used to healing in their own environment. It was really a multifaceted approach to healthcare.
Mm-hmm. And stop me if I'm incorrect, but I feel like I heard a lot of, during the pandemic, not necessarily hospitals being overwhelmed, but having maybe a higher volume, or the emergency room just being kind of full to the brim of folks who really didn't know what to do. So then just adding yourself to the mix would be very stressful.
And that is exactly, Lacey, you hit the nail on the head, how this was born. We weren't inundated with patients. What was scaring us was the places that we send our sicker patients to, larger urban areas, they were inundated with patients. And so we knew that we needed to pivot and really care for our own people. And we needed to do that in the best way that we knew how. We already had a service of EMS folks going into the homes, so why not broaden some of their scope? Why not train them a little bit differently, offer this service a little bit differently? And we were able to use it during our times of surge. We did go through that time where our hospital was full and our emergency room was holding patients waiting for an open bed. And if we were able to send someone home safely, knowing that this mobile integrated health team was going to go in and check on them in the morning, it was a safe discharge plan, and it helped get other people seen as well.
right? A little word of mouth of, hey, you know, I've taken advantage of this service and it was great for me. You might think about giving it a try. I have to ask though, for your EMS workers who are on the front lines, who are now being sent into the homes where someone could potentially have COVID-19, what was it like for them? Did you hear any feedback?
Well, I think for all of us, I can speak that the unknown is scary.
Yeah.
You're fearful when you don't have the knowledge. So really it was embodying them with the knowledge and putting some of the experts in front of them, letting the physicians talk to them about what they knew and what was coming down their channels of communication, making sure that we listened to their needs as far as, do you have the appropriate PPE? Do you have a well-fitting N95 mask? Do you have a pair of goggles that you're comfortable in, that you can see in, that you can take a blood pressure in and you can see the numbers? They're not fogging up, you know, all of those types of things that we've all experienced. And then really just listening to them. Many of them were not fearful when they had the knowledge, and they really began to see the need when they were going into these homes where an elderly couple, the wife may have COVID and she's typically the caregiver in the home, and so the husband is trying to fumble and make a grilled cheese, and they're like, here, let me help you with that. So they got a sense of fulfillment that they were helping, and that's what they went into that profession for.
And it's some very individualized care, which I think might be a breath of fresh air for some folks who maybe their experience with the health system is they go in to speak with the doctor and they feel like they're on the clock maybe of 15 minutes, and it's like, how do you get all of your information and your ailments out in 15 minutes? So this program though, it's staying rooted even though COVID at this point has kind of drawn back. So you mentioned some of the conditions that folks were getting help with. Can you kind of walk us through some of those and what a typical session of care might look like?
Exactly. So I told you previously that we were trying to get this off the ground, but we didn't quite have the buy-in. And when COVID happened, we got the buy-in. So then it was really easy to shift and say, see, remember when we told you that we could monitor your diabetic patients for you? We told you we could monitor your congestive heart patients for you to make sure that they don't have a 1 or 2 pound weight gain and they're not getting in trouble. We told you we could monitor those COPD patients or chronic obstructive pulmonary disease patients. We could watch their oxygenation levels to make sure they weren't developing a pneumonia. That was the type of patients we were looking to enroll in this program in the beginning. And so once we saw a decline in the amount of patients we were seeing from the pandemic, we started to pick up some of those chronic health patients. For example, a diabetic patient. We were able to go in to their home, do some teaching, do some education, say, hey, open up your cabinets. Show me what you would normally fix for lunch. Okay, is that really what is the most healthy? What we were finding was people didn't really know what the doctor spoke about in the office, how to apply that in the home setting.
Wow.
And so we were a little bit more of a bridge for that. One of our examples is a young female diabetic who was a very brittle diabetic. And she had 2 small children at home, ages 4 and 2. And the 4-year-old was trained to call 911 when mommy's blood sugar dropped and she started getting sweaty, passing out, because daddy had to work night shift in order to be able to care for their family. And this patient knew that she had this condition. She had been educated from her physician chains, her diabetic educator chains, but it wasn't connecting at the home level. Once the paramedics got into her home and realized she wasn't checking her blood sugar frequently enough, they were able to facilitate for her some different types of monitoring devices and train her how to check her blood sugar more frequently, adjust her insulin accordingly. And she is one of our greatest success stories because her child has not had to call 911 for well over a year.
Oh my gosh.
So you know you have a child that's sleeping well at night now.
Yeah.
He's not afraid that he's something's going to happen to his mom. Her endocrinologist was actually in Indianapolis, and he called us and said, I need to know what you're doing with her because I've not seen her this controlled for so long. And we explained the program to him, and he was very complimentary of the program. She is on one of our remote patient monitoring devices of our glucometers.
Wow. And so the pressure is off for that child, you know, it's something that they should never have to worry about in the first place. And it's just really a testament to, sometimes we get into a room with our doctor, and this is not to knock doctors. We love them on the show, of course, but there's just so much information getting thrown at you that until you get to walk through it in that type of scenario, you don't know what you are or aren't doing wrong. It's kind of hard to troubleshoot on your own.
Exactly. And doctors are limited in their scope. They have a large patient panel.
Yes.
You're exactly right. It is nothing. We work in conjunction with them.
Yes.
We like for them to identify their patients that are at risk and refer to us so that we can go in the home and do a lot more thorough assessment because we have more time to give, we have more resources to give, and then we can communicate back to them and say, here's what we found, here's our recommendations, would you like to enroll them in a remote patient monitoring program so that you can see them more frequently? We can communicate that to you. Just work in tandem with one another.
Yes, it's comprehensive, it's a team effort, and of course a healthy patient is always the goal, always the win. And so you keep mentioning our remote patient monitoring. So let's dive into that side of it a little bit. You had mentioned like the glucometer. What is this side of the program?
So I mentioned to you that mobile integrated health, was a free service. So we all know free things don't last very long, right? So I told you I loved to innovate. And one of the ways that I decided to offset some of the costs for the mobile integrated health was to begin this remote patient monitoring service. Again, I didn't invent the wheel. All of the things are free for searching out there on the internet. Other places offer this as well. But we worked with our electronic health record company and determined which services were already interfaced with that. So what I mean is if I give you a blood pressure cuff that is 4G enabled and you're going to take your blood pressure 3 times a day, that is going to automatically feed into your health record so that we, the mobile integrated health team, can see that and monitor that, and we know when Lacey's getting in trouble because her blood pressure's climbing, and maybe we need to contact your doctor for you and do a medication adjustment. Or maybe we just contact you and say, Lacey, anything going on? And you're like, yeah, I've been really stressed. Yeah, exactly. So that's where we come into play. That service is a billable service. Okay. So that helps offset the free service.
Interesting. And so we were talking about, or you had mentioned the having a heavier heart or heavier weight, and it's related to your heart. Can you explain that a little bit?
Yes. Congestive heart failure, I really wish that was something that we could rename.
Yeah.
Because it is very confusing for people. When people hear the word heart failure, they think, oh, my heart is going bad. Mm-hmm. Well, in a sense it is. But the heart is a muscle, and it's a pump is really what it is. Mm-hmm. And when you have too much fluid in your body, your heart gets worn out and doesn't want to pump as effectively. So it backs up that fluid, hence the word congestive. So when people have a failing heart or a failing pump, they tend to store that fluid in different locations. And how we monitor that is via a daily weight. So if we can see that your weight is increasing 1, 2, even 3 pounds, and we know you have this diagnosis, we've done testing to know that your heart is not working effectively, mm-hmm. then we can offer medications to offset some of that fluid. Mm-hmm. and keep you out of the hospital so that you don't get into breathing trouble, severe trouble related to increased fluid in your spaces.
And so you've got folks who are monitoring this information. So if they notice remotely, hey, you've gained, 2-3 pounds from yesterday, this might be an issue. You might need to go to see your physician or go to an emergency room. That's kind of the goal of this program, correct? Is to catch these things early?
Exactly right. We want to catch them early. The goal is not to get them to the emergency room. Yeah. And that is one of the tracking things, is how many people can we keep out of the expensive emergency room. But it is, how you said, instead of seeing your doctor, we can collaborate with the doctor and say, hey, the doctor has said we want you to take an extra dose of medicine today. We're going to monitor you again tomorrow and see what your weight change has been. It is to catch them early. It is to keep them out of the hospital or out of the expensive healthcare system. It's to help decrease the amount of healthcare costs to them. So we monitor them frequently, monitor them early. But again, we may call them and say, hey, Lacey, I noticed you had a 2 or 3 pound weight gain. What's going on? And you said, oh, well, I went to a cookout and I had a hamburger and fries. And we said, okay, well, sure. It sounds like you got a little off track. I'm going to call your doctor. He's probably going to ask you to take an extra dose of your medicine, but I am going to check in on you tomorrow as well. Make sure today that you stay on track. You're drinking plenty of fluids. You're watching your sodium intake. It's educating the patient, but it's also helping keep them engaged in their own health care and be accountable for that.
And so it sounds like a lot of what you're talking about is being more on the offensive of your healthcare than defensive.
Exactly. I love that. Yes.
So as we're in our last several minutes here, are there any cases that come to mind other than our diabetic patient, which is just incredible, but that either of these programs or being able to do the remote monitoring has been especially helpful?
Well, I have tons and tons of success stories, so it's hard to pick just one, but I can talk through a couple. We talked about COVID in the beginning, and while we were remotely monitoring their oxygen level to make sure that they were not getting into trouble with COVID, the bonds that were formed between the healthcare worker and the people who felt really isolated in their homes was some of my greatest success stories, because we were that lifeline to people. I mean, when people were put into quarantine, they were essentially banned from doing anything. So they looked forward to those healthcare workers coming into their home because that was their point of contact for the day. So I have healthcare workers who made stops at the grocery store to get them juice and fix their grilled cheese in their house. While they're in there, they kind of do a safety assessment as well. So they take up any rugs, they ask them about grab bars and handles, make sure their furniture is appropriately spaced if they're using a walker or a wheelchair so they don't get stuck in a location. So it's really a full circle moment. But then also looking at the chronic illnesses, we have been very successful in decreasing our readmission rates to the hospital from that.
So as we're talking about these programs, how do I get connected with one? Is it something that a doctor recommends me for, or how do I find you all?
Our preferred route is that you get a referral from your primary care provider.
Okay.
So if you have one of those chronic conditions, you're diabetic, you have hypertension or high blood pressure, you have congestive heart failure or COPD or COVID-19, ask your provider if they offer the service of remote patient monitoring so that they can see you in your home and basically check your vital signs to make sure you're doing okay.
And we've talked an awful lot about folks who are good candidates for this program. Is there anyone in particular who maybe shouldn't? This isn't exactly the route that would be good for them.
No, I don't think that there is anybody. I think we have all kinds of tools that we can remotely monitor you from. Many people are beginning to get a little bit more engaged in their healthcare by wearing pedometers or smart watches or different things like that that track different things. Those are all types of remote patient monitoring, and many of them can be fed into your electronic health record so that we could monitor that on a more regular basis.
So you're getting the doctors on the clock and sort of off the clock in our last minute or so. Is there anything else about these programs, this service that you'd like to share that I didn't ask about?
I think that the most important thing is don't be afraid to ask. Don't be afraid to say, I don't understand. I have diabetes and I don't understand. And there are resources, whether it's our team or a team of diabetic educators. Make sure if you have a chronic condition that you are asking for help up front, because you don't want to get into a state where you are gravely ill and wish that you had asked in the beginning. So just staying engaged. I always tell my parents, if you don't take time for your wellness, you're going to be forced to take time for an illness. And we all know time is precious.
Oh, that's good. We got to get that on a t-shirt or something.
Yes.
Well, Samantha McCarty from Horizon Health, thank you so much for coming on our show today. We sure appreciate it.
Thank you, Lacey.
Of course, and we hope our viewers will join us for our next episode of Being Well.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.